My favorite activity probably is walking with my neighbors. Gets a chance to really connect with them, and riding my bike. I love the nature and I love being outside. When the pain first started, it was like, getting pinched, and it would just, pinch, and then it would go away. And certain activities would be worse than others. And then it progressively got worse, and it got to the point where I started limping. I had a neighbor that had the traditional type of hip replacement, and she, after a couple months, still was having difficult walking. And after her surgery, she told me that she was black and blue all up and down her hip, from practically her waist to her knee. And I just could not imagine myself going through that. I just knew there had to be a better way, and so I decided to wait. SuperPath came to my life through the mail, and it was pretty exciting because I got this flyer in the mail that there was going to be a seminar given by Dr. Olsen at a local hotel. I finally decided to go with SuperPath once I realized that my hip would not have to be dislocated and that the recovery time was so much quicker than all the other methods. When I woke up from surgery and I was fully conscious, I noticed that the hip itself had no pain, which really amazed me. And the pain that I had was in the muscles of my legs because, they had to move the muscles around to do the surgery. But it was a great feeling to know that the hip did not hurt. I think I got out of surgery about 11 o'clock, and at 3 o'clock was the first time that I walked, which was pretty amazing. And then about 7 o'clock that night, I was able to walk to the end of the hall and back. I was real happy that I was able to leave the hospital right away, the next day actually. It was just a good feeling to know that I didn't have to stay longer, or as I had heard, some people would have to go to rehab after surgery. I didn't have to worry about any of that. I used the walker for probably maybe a week at the most. And then I started using the cane, and I used the cane for maybe a week or so. And then the last 2 weeks I've been just walking on my own, and I found that I could do it. I was very pleased that I can walk without the assistance of any device. I've talked to other people who have had hip surgery, and I've seen their recovery period, which has been rather long. And I am absolutely amazed that it's been just almost exactly a month since my surgery, and I'm walking without the assistance of a cane. I'm able to walk with my neighbor. I'm able to ride my bike. I can walk my dog. There isn't too much that I'm not able to do right now. Right away, I knew I had made the right choice. When I was able to walk just a few hours after surgery, I was ecstatic. I knew that this was going to be a good outcome. And every day it's been better and better and better. And it's just been a good experience. And today, I couldn't be happier with how I feel.
These results are specific to this individual only. Individual results and activity levels after surgery vary and depend on many factors including age, weight, and prior activity level. There are risks and recovery times associated with surgery, and there are certain individuals who should not undergo surgery. Only a physician can tell you if this product and associated procedure are right for you and your unique circumstances. Please consult with a physician for complete information regarding benefits, risks, and possible outcomes.